The affordable health care marketplace opens tomorrow, creating a lot of confusion for Missourians on Medicaid.
KOMU8's Lauren Bale did some digging and joins us in the studio with more on who will be affected by the changes.
Many families I talked to who are on Medicaid were confused and worried about what will happen under the new health care system. One family I met was able to give their daughter expensive medical treatments because of Medicaid, treatments that they wouldn't have been able to afford otherwise. I found that some people's access to care will remain the same, and others may have more difficulty receiving the kind of care they need.
She was a very good baby.
On July 2nd, Josh and Rihanna Robinette's lives changed when their daughter Aria was born.
And there she is getting her brother.
Just 18 days later, their lives changed again when they got the news no parent wants to hear.
We found out that she had 2 types of leukemia, ALL and AML.
What followed was 14 months of hospital visits, surgeries, and one form of treatment after another, paid for by Missouri taxpayers through Medicaid.
Each bead represents a procedure of some kind that she's had done, whether it be chemotherapy or a blood transfusion or a platelet infusion, surgery.
Procedures that come at a heavy price.
I would assume well over $1 million.
Was some shots that we were giving her, it wasn't even a milliliter on the syringe. And just that little shot, just a little bit of liquid, about that much, was over $3,000 if we would have had to pay for it.
I mean, there's no way, anybody could really afford something like that. I mean, it was ridiculous.
Because their kids are on Medicaid, the Robinettes were able to give Aria the treatment she needed without worrying about the cost.
I mean, even at the end, we didn't give up. We tried everything. And in our case, it just didn't work for us. It didn't work for her.
Aria died at home with her parents a little more than a week ago.
Within the next 24 hours, she was gone. I held her hand through every single bit of it.
Since Missouri voted against expanding Medicaid, 300,000 people who would have been covered under an expansion might not have access to the kind of care Aria had.
So those are the people who would, they would not have to pay a penalty for the individual mandate in Missouri. But they also don't have insurance, which is a problem. So, they don't get anything. They're just not penalized for not taking an action.
The people who fall into that gap are making less than 138% of the poverty level and will likely have to settle when it comes to medical options and seek out federally qualified health care centers or treatment.
It's going to be hard to get away to go to a clinic that's open from 8 to 5. And so you do it after work, you do it in the middle of the night when that condition you have reaches a point where you have to get care. And then you go to the emergency department. And then those costs, if you can't pay it, are shifted to everyone else who has insurance, and insurance rates go up for everyone.
Some Missouri lawmakers say the reason they voted against expanding Medicaid is because they're not sure of the implications the Affordable Care Act will have on the country.
I would say the biggest reason is that we fully do not understand what the ACA, Accountable Care Act, is going to do. Right now, there's only 18 states in the United States that have agreed to participate, so Missouri is not the only one that is holding out to trying to figure out what's actually in the bill and how it's going to directly affect this state.
The Robinettes say the time they had with their daughter would not have been possible without taxpayer help.
We were very lucky.
Tomorrow, people will be able to view health insurance policies in the marketplace and learn if they qualify for insurance subsidies or for Medicaid.
In Oklahoma,